Hi, I'm Jamie from Edge Surgical, and I'm here to talk to you about depth gauges. Depth gauges are surgical instruments used in every single plate and screw case. They're about the size of a pencil, and they work like a ruler. They're hard to read, they're bent, they're hard to assemble and disassemble, and there's a lot of different varieties of them. At any hospital, SPD receives between 3 and 50,000 instruments a day. Some of them are depth gauges. Given the complexities of depth gauges, it's really hard for them to clean these properly, and it's really hard for them to know how to put it back together, if it's even supposed to be put back together, prior to the case. In front of me, I have a lot of different examples of depth gauges that are out on the market today. A lot of them you've probably used before. I'm going to show you a couple examples of depth gauges that I find that are really difficult to disassemble. For example, this first one, it comes apart in 4 different parts. This one, you can see, has a very bent probe in addition. We don't even know how to take this one apart. This next one has a really unique mechanism in that you twist it to pull it apart, and then it gets a little jammed. And then you're supposed to clean inside of here. If you hadn't just watched me take this apart, how would you know what goes where? This is what SPD deals with every single day. You might be asking yourself, well, how does this get cleaned? Well, that's a really complicated question, honestly. What the reality is when it comes down from the OR, there's supposed to be point of use care. Then it's supposed to be dipped in a bath and decontam. Then it goes through a washer to SPD. And then somebody in SPD picks this device up. They're supposed to take a brush through it, a borescope, if they have them, and then assemble them. They put it back in the tray. It goes into an oven, for lack of better terms, and then it's sterile. The problem is that the instructions for use are really general, really vague, and how are you supposed to remember 50,000 IFUs? Now let's imagine we're down in SPD. You've gotten the depth gauges, they went through the wash. In theory, they're clean, right? Well, maybe. A lot of depth gauges are cannulated instruments. As you can see, they have a big cannula, a big lumen in the middle. How can you tell if this is clean? Some facilities have something called a borescope. It's kind of like a camera. It looks down inside. Sometimes there's rust, sometimes there's pitting, sometimes there's blood, guts, and gore. But if you're not using the borescope, how do you know it's clean? Can you see through these perfectly? Because I know I can't. As you can see, there's a lot of different pieces that are on each depth gauge. Typically, there's a nose, the cannula, and sometimes there's just some extra parts. So let's give it a try. Looks like this one might be the cannula. It actually has a nose on it. I see one without a nose, so let's figure that out. Let's see. Okay, there's a nose. Now it needs a little ruler bit. Wait, now I put the nose on. Okay. Oh, that doesn't fit. So then I had this one right. Okay. Where does this go? Something maybe like that? Okay. We're getting there. This one had a collar, so that was a little extra piece, one that I'm not used to seeing. So this one has a nose on it. So this one naturally has to be the nose there. And great question. Okay. So it took me a couple minutes to put those together. I've asked other people to do this, and it literally takes them 5 to 10 minutes to put these together. Now that we've gone through a few of the issues with traditional depth gauges, they're bent, they're hard to clean, they're hard to inspect, they're hard to read, and they're just hard to work with. Let me show you something better. This is the electronic depth gauge from Edge. It's a sterile, single patient use instrument with a digital readout on the screen and a patented hook design with a better grip. This arrives into the operating room sterile packed and ready for use. Once open, all you do is remove from the packaging, pull this tab, and prime it. And it's ready for use. Now that we've talked about a lot of different issues with different depth gauges, which one are you going to choose? The Edge, that's compatible with all major plating platforms, or all of these? You tell me.
EDG is universal, compatible with major plate and screw systems used across orthopedic trauma, reconstruction, and extremity procedures. Start ordering EDG for your orthopedic cases and stop worrying about the danger lurking in your instrument trays. To learn more, contact Edge Surgical today.